This is real, it's here, it's deadly, and the advice that's been given does not need to be ignored, and that advice has to do with washing hands, social distancing, and you will hear us say it more and more about stay at home. But it's very, very important that you adhere to those. We know that we have challenging and difficult days ahead of us, but also know that we are doing a whole lot of things to try to protect you. The ongoing process of working with the Infirmary Health System to stand up their site at Hillcrest and Hillcrest and Airport Boulevard, that is almost complete, if not complete, and so there'll be more testing that will be done there. While these tests are by appointment only, you don't have to be a patient of the infirmary in order to be able to be tested there. But there is a phone number that probably will end up being on the city website that you can call, but it's 435-1106. 435-1106 if you want an appointment at one of the diagnostic and medical clinic sites. USA Health Center, we're working with them, the University Hospital, to stand up Ladd Stadium. We've been talking about this for a week now, but by Monday, probably all the facility part will actually be in place as they have kind of redesigned it. And by Wednesday, the city should have enough testing kits so that all of our off-site testing is actually in place. So by Wednesday, the site at Ladd Stadium should be fully operable. You know, as of today, we've had 17 cases test positive. Based on information that we know and that we expect, based on what's happened in other cities, we can expect a sharp increase in that simply because of the numbers that are being tested. I will remind you, though, that we're really only testing sick people. We're only testing sick people, only those that we really believe have the coronavirus. So it's not completely unexpected that you will start getting a higher return rate on those that are being tested, but still the numbers are going to climb no matter which way that you look at them. Our goal is to stop the virus. And the way we stop the virus is that through the testing, we identify who is sick, we test those and identify those who may become sick. We try to quarantine them, and the others that don't have to be out and about in the community, we're encouraging you to stay home. We continue to repeat this, that there's only so many things that the government can do to protect you, but ultimately your health and your safety has a lot to do with the decisions that you make. We have received the governor's order, the same thing that you've seen. If you haven't seen it, it's on the city website. It's probably multiple places where you can find it. We were aware that she was going to issue that order, and there was, because of that awareness, we realized that since that was going to happen, and because we are operating in concert with the governor, you know, we realized that we didn't need to do anything more than that at this point in time. Our city operations will continue. For those businesses that are curious about whether you should continue operating or whether you are one of those that has been exempted, if you are not listed as non-essential, assume that you're essential and continue to work. Now we have Ricardo Woods with us today, the city attorney, who could probably answer more specific questions about the governor's order. So at this time, I'd like to introduce Dr. John Stone with the Providence Hospital. And Dr. Stone, if you can come up and tell the media and the audience what is going on at the Providence Hospital as y'all continue to prepare for the coronavirus.
Thank you, Mayor. At Providence, we have been working on preparations for this for almost a solid 2 weeks. We all gathered Sunday 2 weeks ago and spent several hours trying to put together a plan. We began looking at our elective surgeries and trying to get those canceled or postponed, as it were, because they'll still have to be done at some point in time. So we worked with our surgeons on that. We worked with the cardiologists and cath lab. They've all been very cooperative. The patients themselves, of course, sometimes drive this because they decide maybe they don't want to come to the hospital under the circumstances. So we've worked on that and made a big dent in that. And one of the big reasons to delay those cases, from our standpoint, is to preserve your personal protective equipment, because as you can imagine, any sort of procedures that are done always use a lot of equipment. And so if you can save that for when you are in the crunch of the situation, that's really better. We have cohorted our various either positive or under investigation patients in specific locations. I think that's pretty much something that everybody's doing. The intensive care unit, one of the intensive care units is where the positive patients go if that's required. The others are on another specific ward in one location, and there are several reasons to do that, but once again, one is to limit the amount of equipment that you're using. It's not spread out over the entire hospital. But those are the main things that we've done. The testing has been, as the mayor said, that's one of the big items that's been a problem. When we were sending everything to the state, I mean, you can screen, you can collect the material to send, but if you don't get the test result back, you're kind of sitting there in limbo for 4, 5, 6, 7 days, and it depends on where you send it. But the state lab was running about 5 days for waiting, so that's a long time to wait for a test result. When Sacred Heart Hospital in Pensacola is one of our sister hospitals within the Ascension Group, which is, of course, a national entity. They now have testing, and I think even the infirmary, other hospitals here have been taking advantage of their ability to do tests quickly right now, and hopefully the things that are proposed from Mobile will make it so that we can get things that quickly here without having to send it to some other location. So those are the main points I wanted to make, so I'll turn it back over. Thank you.
Thank you, Dr. Stone. I want to correct myself. I was looking at my yesterday's note. It's actually 23 cases that we have, and I think that you know that, but I just read the wrong note there. Also with us we have Dr. Bill Admire from the Infirmary Health Systems. So Dr. Admire.
Thank you, Mayor Stimpson. The Infirmary Health System, like Dr. Stone at Providence and Dr. Summerall at Spring Hill and other hospitals, we're preparing for this COVID-19 pandemic. It is very important to know we're going to follow the state, local, federal guidelines per what they need to us to prevent and blunt the expansion of this pandemic. At the Mobile Infirmary Hospital, we have formed a COVID-19 leadership by the medical staff and 15 subcommittees led by physicians working with administration and nursing. And what we're doing is planning, increasing our bed capacity, increasing our ventilator capacity, getting our nurses ready, along with the physicians, to take care of these sick people that come into our hospital. We're also going to separate the COVID positive patients from the COVID negative patients, so we don't have cross contamination of this COVID disease. Doing this, we're actively doing this 24/7. Tests are coming back. We're going to see more positive tests, I promise you that. The Infirmary Health System, in conjunction with the City of Mobile and the Mayor and Mr. Jim Barber, have these two pop-up clinics, one on Hillcrest and one on DMC on Spring Hill. You can call that number 251-435-1106, set up an appointment, only if you're symptomatic. If you have fever, cough, shortness of breath, and you're feeling fatigued, you call up, you'll be screened, they'll have an appointment, and you drive up and you'll be tested. You will get a COVID test if you're symptomatic. And then if you're sick enough, you will not just be sent home. If you have indication to go to the hospital, they'll send you to the hospital to be seen by a doctor. But when you pull up to the clinics at Hillcrest and at Mobile Infirmary on Spring Hill, there'll also be a doctor or a nurse practitioner together to see you. The city, the hospitals, the doctors, nurses, and such, we're preparing for this. Our job is to keep our community safe, blunt the expansion of this pandemic as it spreads to us from other areas. Our brothers and sisters in New Orleans are having a tough time right now. That's 150 miles away. You know what's going on in New York City. The important thing is, like Mr. Mayor Stimpson said, we need to social distance. Keep your hands clean and practice this. At the same time, health officials, doctors, we understand that the business world has to continue because that's what keeps the economy going so that we can take care of our people in hospitals and such. But the doctors, the hospital administrators, the business people, the mayors, the leaders of our communities working jointly together can make great decisions to make sure that our people and our citizens have the best health care possible and have the best outcome from this pandemic. Thank you very much.
Thank you, Dr. Admire. At this time, I would ask Brian Sumrall with the Pulmonary Associates, which really work at all the hospitals, to come explain what they're doing in their practice and what they're doing at the other hospitals.
Excuse me. Yes, my group, we are the critical care physicians at Providence, Spring Hill, and at Mobile Infirmary. I work mainly at Spring Hill, so I can speak mainly for what we're doing there. I, along with my partners, have been in basically daily communication with the administration of the hospital, trying to best plan for this. We have been in contact, my partners and I, with the physicians across the country about what they're kind of seeing at their hospitals, about what they're having to do, because this is obviously uncharted territory for all of us. We are doing our best to set up for this, get ready for us. We have had the advantage in Mobile in the fact that the wave has not quite hit us yet. We believe it is coming, but we've been fortunate that we have had a few weeks to prepare, whereas other cities in the country have not been as fortunate. I feel that Spring Hill has gotten as ready as is humanly possible. From my discussions with my partners at Mobile Infirmary and at Providence, I feel the same about those hospitals. We obviously all have been focusing on trying to get as much personal protective equipment as we can, which is obviously an issue nationwide. We have been setting up units to separate the COVID patients from the other patients. We have been setting up infection control protocols to make sure that no other patients are exposed. I think it's pretty safe to say that all the hospitals are working extraordinarily hard to make sure that we are ready whenever this does come. I pray that we have over-prepared and that we don't get hit as hard as we think we are going to, but we need to assume that we are. The biggest thing that everyone at home can do, myself included, is social distancing. Don't go out unless you have to. Wash your hands. There is a tendency when things kind of keep going and the numbers maybe don't seem as bad as you think they are, doesn't mean you can all of a sudden just stop what you're doing. Just keep doing it. Like they said, our numbers are almost certainly much higher than what we have. We are not testing everyone yet. When we reach the point that we can, these numbers are going to go much, much, much higher. So once again, hand washing, social distancing, know that we are doing everything on our side to make sure that everyone is taken care of. Thank you.
All right, thank you, Dr. Sumrall. So I'm going to end with a story, but before I do that, I would like to open it up for media questions, and I will point to whichever. If you have a specific doctor that you would like to speak to, you can ask the question specifically to him. He will walk up and take your question. So we'll open the floor up for questions. Yes, ma'am.
Mayor Stimpson, we're hearing a lot about New Orleans today being kind of a new epicenter, a new hotspot for coronavirus. Today we're also hearing that Florida is putting checkpoints in place to check for people who may be coming from Louisiana. Will Mobile be doing anything? Have you spoken to the governor at all about anything?
So we are aware of the checkpoints, the limitation of travel back and forth between cities, especially coming in and out of hotspots. I've not actively engaged with the governor to ask if she thinks it's necessary at this time. You know, at some point, you know, we will continue to process that information and make the determination when we think it warrants that. Yeah. But I will, that's a good point. When somebody decides that they want to go to New Orleans and it's a non-essential trip, I would strongly suggest that you not do that. You do not need to travel into any hotspot and then come back home. That's ludicrous. Yep.
Do you think that there should be checkpoints put in place?
It may come to that. I don't think we're quite there yet. Yep. Keep on.
Okay. With the social distancing order in place, what are buses going to be making any kind of difference?
So on the buses, I think you've already been told that there is a lot of cleaning. 5 to 10 times the amount of the cleaning that's been going on, and there is a request for people to distance themselves on the seats in the bus. Don't be sitting by each other, skip a seat, and those types of things, so that you can get the proper social distancing.
So will those keep running as long as possible because
Our buses need to run as long as possible because there's so many people that don't have any transportation otherwise to get to the places they need to go, and it would be a severe impairment to them to shut the buses down. Yeah. Yes.
Do you think
So there's no way for me to know that. Obviously you have a lot of, the question was, do we think that the coronavirus had a lot to do with where we are because of Mardi Gras coronavirus and where we are today? I don't know how you tie that together. I know there's been a lot of conversation in New Orleans that they had 1 million visitors and that they think that hurt them. Mobile is a little bit different than New Orleans in our Mardi Gras celebrations. We do not have the number of visitors coming to Mobile like they do in New Orleans from different and faraway places. Yep. Dale, you right? You good? Yes.
by next week you said that lab will be able to start testing, right? Do you know how many people they'll be able to test in different off-site?
So I don't know the exact number, but and it's going to depend on the kits, how we stand it up, but we're hoping to open on Wednesday, and whatever we do on Wednesday, we will do more on Thursday. Whatever we do on Thursday, we have to do more on Friday, and then by the following week, we hope to have hit a stride where we're taking care of whatever the needs of the community are.
I do know that USA Hospital said yesterday they tested 400 people. Do you have an idea of how many people have been tested in Mobile so far?
I do.
The hospitals and everything, the health department, all that stuff.
I think, Dale, don't hold me to this, but I think it's 490. I think it's 490 that have been tested. That was as of yesterday.
That's in the hospitals and clinics as well?
Well, the challenge is that I think that was all because the clinics were really doing very few.
Okay.
The challenge going forward is going to be the clinics reporting in the same manner that the hospitals are reporting so that we can fully track it.
We saw a lot of tests out here yesterday, and you mentioned the city having about 2,000 of them. What is the cost to the city for this testing, and how is the city paying for it? Is it a rainy day fund or something?
So the tests that you saw yesterday were the serum, the rapid serum test. Those were actually donated by a lab. Okay, there were 2,000 of them, and they cost about $15 each. Okay, when it comes to the nasal test, the swab test, it's $51 or $52, something in that range. So if you go to any of the providers, my understanding is that they first want to know if you have Blue Cross, if you have health insurance. If you have health insurance, your health insurance will be billed for it. If you don't, then the Mobile County Department of Health is trying to make the determination how will they cover the cost for those that don't have insurance or may not be covered by Medicare or Medicaid. But I do not know exactly how that's going to completely work out at this point in time, but they are trying to make sure that anybody that needs a test, that they'll get the test. And the details of the exact pay and how it's handled are being worked out as we go.
So to clarify, no one who needs a test, insurance...
Anybody that needs a test will be able to get a test, but they have to pass through the screening process. They have to go through the complete process to be approved to have the test. If I just chose to go because I'm curious, they would turn me away. That it? That's the case. So no questions for the doctors. All right. Yesterday y'all gave Dr. Chang a lot of questions, so obviously y'all did a really good job today, not that he didn't do a good job. But let me show you this. I started off this morning going to Caligag's Printing, and this is a face shield. It was one of the first ones that they made, and the way this came about was that Joe Caligag's and his wife were talking about what are they going to do during this pandemic to keep their company running. And they decided they were going to adopt a new slogan for their company, and it was going to be clean up and cross-train. Clean up and cross-train. So they were going to try to take all of their employees, cross-train them, doing something to clean up just to be able to exist so they could keep them on the payroll. Well, then one of the employees saw on the TV that there was a tremendous shortage of the face shields. So he went around and found different things in the back of the shop, this printing shop, and he created one that looked something like this one. And he walked over to the production guys and other guys out there on the floor and said, "Can we build this?" And they kept talking, and they finally said, "We think we can build this." So this morning when we were there, now this started last Thursday, so here we are 8 days later. I'm guessing that by tomorrow they'll be making 5,000 a day. My understanding is that they have an order for each of the hospitals has ordered a number of them, because this is disposable. It's in short supply, just as are the N95 masks and as are the gloves. But there is somebody out there trying to figure, how do they make the mask? How do they make the gloves? How do they make all the protective equipment? And American ingenuity and entrepreneurial spirit are going to do things that have not been done in order to make sure that we address all the issues that we have. Another case in Mobile is that the testing kits. And you've heard us mention the laboratory that is now set up. The equipment came in early this week, and that's why we keep saying that by next Wednesday, we're hoping to be able to test. Well, we start the testing Wednesday. By Friday or the following Monday, we should be able to test anybody that needs to be tested. And the results of the tests will be able to be done here in Mobile. We won't have to be sending them to Birmingham, Huntsville, Atlanta, to get the results. All of that is a huge step in the right direction. When you take that the governor had the order to close the public schools Thursday, a week ago, I believe it was, and then with the closing of non-essential businesses, if you think about what's coming, that the real impact of the COVID is not here. Hopefully we are a little bit ahead of the curve. We've had some time to plan. Unlike New Orleans, where it's on them full force. They didn't have the testing kits. They didn't have somebody making these. So as the doctors have all told you, at every hospital, every healthcare person is trying to determine a way to make sure that you get the best possible care, and that we, in collaboration with them, are working to try to protect you, so that when all this is all said and done, if you visualize that what's been told to us, that you want to categorize the COVID pandemic as a Category 5 hurricane that's just looming out there in the Gulf. What we're hoping and what they're hoping is that in the city of Mobile, it's going to be a 2 or a 3. And if we do the things that we've asked you to do, we're going to be a whole lot better off, and we'll be able to say we kept that Category 5 offshore, and that's what we're asking you to do. So thank you very much for being here, and we will have another briefing, George. We'll have another briefing Monday, unless there's something that occurs, and I'm not sure it will be here, but if we have to communicate with you over the weekend, we will reach out to you. So thank you very much.
All right, Mayor Sandy Stimpson, just a few minutes ago, talking with Assembled Media and other personnel there at Government Plaza. There he seemed talking with a couple of doctors from Providence and Mobile Infirmary. And today he had those doctors from all 3 of our healthcare facilities, USA, Infirmary, as well as Providence Hospital. And each one of them could not express any stronger for everybody to continue to do what you're doing. Stay in place if you can. Continue hygienic, what you need to do, as in washing your hands very often, staying away from people who are sick. That's number one. But also washing your hands and also staying away from crowds of 10 people or more. But each of those doctors and the mayor also expressing this, that we are going to see a spike in cases because more and more sick people are being tested. However, every one of them stressed that Mobile is ahead of the curve, possibly farther ahead than what New Orleans was, and that they believe that Mobile can weather this storm better than New Orleans because of the preparations that have been made. So again, we want to stress that the doctors and the mayor are saying that the number of cases will spike. They've expected this because they're testing nothing but sick people right now. Not everyone is being tested, but they do say that the numbers will be spiking, but they do say that Mobile is better prepared to handle this spike than, say, New Orleans was, because it just fell on top of them, basically. But as one doctor put it, the wave is coming because they are testing nothing but sick people right now. But they feel like that if people will continue to do what they've been doing, which is practicing social distancing, staying at least 6 feet away from people at all times. That means even in your home, staying 6 feet away from people if you can possibly do it. If you have to go outside, stay 6 feet away from people. Practice social distancing. Also, continue the good hygiene practices, such as washing your hands with hot water and soap for at least 20 seconds. To really wash your hands thoroughly. And then, of course, stay at home if you can. You don't have to be sick, but stay at home if you can, just to keep yourself out of and away from other people who may be sick. But the takeaway from this news conference today is that the mayor says that we may be able to weather this spike because Mobile is better prepared. We'll have more coming up on Fox 10 News at 4 and 5. I'm Byron Day. We'll see you then.